Did you know that according to the National Institute of Mental Health, 1 in 5 children in the U.S. have a mental disability? That is 20% of our children. According to Margaret Bass of the Journal of Autism and Developmental Disorders, published in 2009, animal-assisted therapy, defined as using animals within a goal-oriented setting to implement treatment, has been shown to significantly benefit cognitive, psychological, and social domains, as well as improve balance, posture, and mobility. Now let's talk about how riding benefits people with disabilities mentally, physically, and emotionally. In preparation for this speech, I read numerous articles and talked to many people who are certified therapeutic riding instructors across the country, including Teresa Tucker of the Kids Reign program, a therapeutic riding program run out of our barn here in Huntersville, North Carolina. First, let's look at how therapeutic riding program helps with cognitive development. According to Harris Mavinsky of the Journal of Special Education and Rehabilitation, published in 2010, many children with autism and intellectual disabilities show a 20% increase in sensory and cognitive awareness within the first couple months of sessions. Activities used to stimulate and develop cognitive skills include Simon Says, red light, green light, and catch and throw. For more severe cases, things such as having kids simply take their left hand and touch their right knee or riding backwards makes them use different muscles in their brain than they are used to using. Anytime these kids cross the center line, they use a different part of their brain. Another cognitive exercise used in therapeutic riding is verbal association. The goal is to get the nonverbal patients using words associated with items they use in the program. For example, when they are playing catch and throw, they will encourage the child to say the word ball. First, they start by showing them the sign for ball, which is circle with your hands. They get the kids to associate the sign for ball with the actual item of the ball. Then they get the children to associate the word ball with the sign. Once that connection is made, they will transfer the word ball to the actual item. They will encourage the child to say ball until the attempt has been made by saying buh or even the buh sound. As soon as these syllables are said, everybody cheers and the horse they are on walks forward. This positive reinforcement is what helps them make the connection between speaking and cheering. Once they realize that the cheering is for them, they become much more likely to express verbally. Cognitive development takes the most personalized approach because every child's brain is different. They use the children's reactions to different exercise to personalize their programs. Each child usually has a favorite exercise, so those are the most often used to build positive reinforcement. Those are the differences in cognitive development. Now let's talk about improvements in mobility. Increased mobility can be seen in people who participate in therapeutic riding. A horse's gait simulates the movements people make as they walk, which helps stimulate the mind and body of the patient. According to Ironstone Farm, a therapeutic riding facility in Andover, Massachusetts, riding a horse stimulates people's normal walking movements, which improves overall motor skills, including balance, coordination, normalized muscle tone, and increased stamina. Some activities used to increase mobility include walking, trotting, multiple steering exercises, and two-point. These exercises not only stimulate the patient's mind, but help build the muscle they need to carry out these tasks. These tasks are combined into different games to get the most out of the sessions. Now that we have looked at the differences in the cognitive and physical development of patients, we will look at the emotional improvement associated with therapeutic riding. Children with mental disabilities have been known to have emotional and behavioral issues that are hard to deal with and solve. With the children focused on grooming, tacking, or feeding the horse, their focus is no longer on themselves, which provides a respite for the child's emotions. Since children with disabilities have been known to bond on a deeper level with animals than humans because of their inability to relate to other people, equine therapy is a good option to increase their overall emotional well-being. Horses are a good way to help these children communicate and come out of their shells. Every child could benefit from the bond formed between horse and rider. These horses help these children live their lives to the fullest potential and give them a sense of peace no one else can offer. As said by Winston Churchill, there is something about the outside of a horse that is good for the inside of a man.